80% of strokes have a warning sign. But what if I told you there are 2 hidden causes most doctors miss, silently lurking beneath the surface? I'm Dr. Miles, and today I'm revealing these crucial, often overlooked triggers for brain stroke emergencies, and equipping you with the vital knowledge to respond instantly, potentially saving a life. The thought of a stroke is terrifying for many of us, especially as we age. It's that sudden, catastrophic brain attack that can steal away our independence, our memories, and even our very presence in the blink of an eye. The fear often comes from a feeling of powerlessness, a sense that it could strike without warning, leaving us vulnerable. We hear about managing blood pressure, cholesterol, and diabetes, and we diligently try to do so. Yet, for some, despite their best efforts, a stroke still happens, leaving doctors and families asking, why? This uncertainty can be deeply unsettling, creating a constant hum of anxiety in the background of our lives. A stroke occurs when the vital flow of oxygen-rich blood to a part of your brain is suddenly cut off, or when a blood vessel in your brain bursts. Think of your brain as a magnificent, intricate garden, and your blood vessels as the irrigation system, constantly delivering life-giving water to every plant. When a blockage occurs, or a pipe bursts, that part of the garden quickly withers and dies. In your brain, those withering plants are brain cells, and they can be damaged or die within minutes, leading to lasting disabilities or worse. There are 2 main types of stroke. An ischemic stroke, the most common type, happens when a blood clot or plaque blocks one of these irrigation pipes, leading to or within the brain. It's like a clog in your garden hose. Then there's a hemorrhagic stroke, which is less common but often more severe. This occurs when a blood vessel in the brain leaks or ruptures, causing bleeding into the brain tissue. This bleeding puts immense pressure on brain cells, damaging them. Imagine a pipe bursting and flooding part of your garden, suffocating the plants around it. But here's a crucial point most people misunderstand. Not all strokes announce themselves loudly. There are also transient ischemic attacks, or TIAs, often called mini-strokes. These are temporary stroke-like symptoms that resolve within minutes or a few hours. Think of it as a flickering warning light on your car's dashboard. It goes off, but the underlying engine problem is still there, screaming for attention. Ignoring a TIA is like ignoring that warning light. It's a critical error, as a TIA is a serious warning sign of a future, full-blown stroke. Then there are silent strokes. These are strokes that occur without any noticeable symptoms. They cause brain damage that can only be identified through brain imaging, and they significantly increase your risk of future symptomatic strokes and even a form of memory loss called vascular dementia. These silent attacks are like small, unobserved cracks forming in your home's foundation, weakening it over time without you ever knowing. We all know the common risk factors for stroke: high blood pressure, diabetes, high cholesterol, smoking. These are the visible icebergs that everyone can see and knows to avoid. But what about the dangers that lie beneath the surface? The ones that are often missed, even by medical professionals? It's these hidden threats that can strike seemingly out of nowhere, particularly in younger adults or in those who've managed their traditional risk factors well. Let me tell you about Sarah. Sarah was a vibrant 62-year-old retired teacher. She was active, ate well, and had always kept her blood pressure and cholesterol in check. One sunny afternoon, while reaching for a book on a high shelf, she felt a sudden sharp pain in her neck, followed by a fleeting wave of dizziness. She shook it off, attributing it to a crick in her neck. A week later, she experienced a subtle weakness in her right hand, making it difficult to write, but it also passed. Her family doctor, knowing her good health habits, suggested it might be a pinched nerve or stress. A few days later, during a conversation, her speech suddenly became slurred, and the right side of her face drooped slightly. This time, her husband noticed immediately and called 911 at the hospital. After initial scans showed a stroke, the doctors were puzzled. Sarah didn't fit the typical stroke patient profile. Her blood pressure was normal, Her heart rhythm was steady, and there was no sign of a large clot. It was only after more specialized tests that they uncovered the hidden cause of Sarah's stroke, a cause that almost everyone, including her initial doctors, had overlooked. This is where we dive into the hidden causes I mentioned, the icebergs beneath the surface, that can lead to cryptogenic strokes, those strokes of unknown origin that account for a significant percentage of all cases. These are the crucial insights that can empower you and your loved ones. The first hidden cause is something called a patent foramen ovale, or PFO. Imagine a tiny, naturally occurring trapdoor between the upper chambers of your heart. In most of us, this trapdoor, called the foramen ovale, closes shortly after birth. But for about 1 in 4 people, it remains slightly open. If this trapdoor, the PFO, stays open, it can become a route for trouble. Small blood clots, which naturally form in the veins of your legs or other parts of your body, usually travel to your lungs and are harmlessly filtered out. But with a PFO, these clots can bypass the lung filter, slip through that tiny trapdoor in your heart, and travel directly to your brain, causing a stroke. It's like a small backdoor in your house that you didn't know was there, allowing something harmful to sneak in undetected. This is a significant factor in strokes, especially in younger adults, and it's a condition that often goes undiagnosed until after a stroke occurs. The second hidden cause is called cervical artery dissection. This one might sound alarming, but understanding it is key. Your neck contains vital arteries, like the carotid and vertebral arteries, which are the main highways supplying blood to your brain. A dissection occurs when there's a small tear in the inner lining of one of these arteries. This tear can cause blood to collect within the artery wall, forming a clot. This clot can then either block the artery or parts of it can break off and travel to the brain, causing an ischemic stroke. Think of it like a tiny fray in the inner tube of a tire. Over time, that fray can cause the tube to weaken and potentially rupture or create debris. Cervical artery dissection can happen spontaneously, sometimes after seemingly minor neck trauma, like a sudden head turn, whiplash from a car accident, or even vigorous coughing. It's a common cause of stroke in people under the age of 50, accounting for up to 1/4 of strokes in this age group. And it's what Sarah, in our story, was eventually diagnosed with. The subtle neck pain and transient weakness she felt were early, often missed signals of this underlying arterial tear. These hidden causes underscore why we must be vigilant. While we manage the obvious risks, we also need to be aware that stroke isn't always tied to the usual suspects. Recognizing these less common culprits is the true secret to comprehensive stroke prevention and response. Now that you know about these hidden possibilities, what can you do? The most powerful weapon you have against stroke is fast, informed action. Every second truly counts, as brain cells are dying at an astonishing rate during the stroke. This is why the F.A.S.T acronym is your indispensable guide. Here is your immediate action protocol. Step 1. Understand and remember F.A.S.T. B stands for balance. Has there been a sudden loss of balance, coordination, or dizziness? E stands for eyes. Is there sudden trouble seeing in one or both eyes, or blurred or double vision? F is for face. Is there sudden facial drooping or numbness, an uneven smile? Ask the person to smile. A is for arms. Is there sudden weakness or numbness in one arm or leg? Ask them to raise both arms. Does one drift downward? S is for speech. Is there sudden difficulty speaking, slurred speech, trouble understanding speech, or an inability to speak? Ask them to repeat a simple sentence. T is for time. If you observe any of these signs, call 911 immediately. Note the exact time symptoms first appeared, as this information is crucial for emergency responders. Step 2. If you suspect a stroke, call 911 right away. Do not delay. Do not wait for symptoms to improve. Do not drive the person to the hospital yourself unless there is absolutely no other option. Emergency medical services Personnel can begin life-saving treatment on the way to the hospital, and they are equipped for rapid, safe transport. Keep the person calm and comfortable. Loosen any restrictive clothing. If they are lying down and vomiting, gently position them on their side, with their head slightly elevated to prevent choking. Importantly, do not give them anything to eat or drink, and do not administer any medication, especially aspirin, as this could worsen a hemorrhagic stroke. Step 3. For those who have experienced a cryptogenic stroke, or if you have a family history of stroke at a younger age, proactively discuss PFO and cervical artery dissection with your doctor. Mentioning these specific possibilities can prompt specialized diagnostic tests that might otherwise be overlooked. For PFO, tests like a bubble study echocardiogram can help detect it. For cervical artery dissection, specific imaging of the neck arteries, such as an MRA or CTA, might be necessary. Empower yourself by knowing the questions to ask. Step 4. Continue to manage your modifiable risk factors. Even with hidden causes, the foundation of stroke prevention remains strong. Maintain a healthy diet, rich in fruits, vegetables, and whole grains, and low in sodium and unhealthy fats. Engage in regular physical activity, aiming for at least 150 minutes of moderate intensity exercise per week. If you smoke, seek help to quit. Limit alcohol consumption. Get regular medical checkups to monitor your blood pressure, blood sugar, and cholesterol. And if you have conditions like high blood pressure or diabetes, adhere to your treatment plans and take your medications as prescribed. These are the visible steps that reinforce your body's defenses against all forms of stroke. The journey of stroke recovery is long, often involving a team of physical, occupational, and speech therapists. But the earlier the stroke is treated, the better the chances of minimizing brain damage and improving recovery. For ischemic strokes, there's a critical golden hour for clot-busting medications, and even longer windows for mechanical thrombectomy, procedures that can physically remove clots. Your rapid response makes these life-saving interventions possible. Imagine waking up with the energy you thought was lost forever, knowing you've taken control of not just the visible health risks, but also the hidden dangers. Imagine the peace of mind that comes from being truly informed, truly empowered. By understanding both the known and the less obvious causes of stroke, you gain a powerful advantage. You can take proactive steps to protect yourself and your loved ones, making every moment count towards a longer, healthier life. Your vigilance is your greatest shield. For more life-saving advice to help you live a longer, healthier life, subscribe to Senior Forward Health.